Now, with cold and flu season just around the corner, it's worth noting that as much as nobody likes to cough, it can actually be good for you. Now, in order to better understand this, it's important to understand what mucus is, how it's different to phlegm, and the role that both of them play in our bodies, especially in relation to coughs. Now, to help us unpack this further, we have a health practitioner, Dr. Marlin McKay, joining us in studio. A very good morning to you, Doctor. Thank you so much for joining us.
Thank you very much.
Let's just start with the difference between mucus and phlegm and possibly how they relate to the cough in the body.
Okay, so mucus is a natural substance that occurs in the body, and it's essential for the body's function, especially in terms of the respiratory tract. So it's a substance that lines the mucus, what we call the mucous membrane. So right from the tip of our mouths down to the bottom of our chest, we have this mucus lining. And this enables good airflow, so it keeps it moist. It prevents bacteria from sticking into the airways and obviously preventing infection. And it assists the immune system to regulate the way the body functions. Okay, so that's just mucus. And generally, at the end of the day, any excess mucus, like I've just done, just gets swallowed and recycled back into the tummy. And so it's a natural process. The problem comes in when we pick up a cold or flu, or a chest infection, or a viral infection, or allergies, sinus season, you start sneezing and sniffing, or any inflammation. This now produces excess amount of mucus. And so the mucus escalator, the mechanism by which the mucus is transported down, is overworked and too busy. And so this mucus tends to build up. And when you start coughing, a wet cough that's coming more from the chest, that's when you start talking about phlegm. So phlegm is when there's excess mucus being produced, the body can't keep up with it, and it's usually as a result of some sort of irritation, mucus, excess mucus production from a cold or flu, asthma for instance, or any inflammation in your respiratory tract causing that excess mucus being produced.
So what about that runny nose effect, if you feel like you need to keep blowing your nose every 5 minutes? Is
so
that
again,
also?
yeah, so when there's a viral infection, a common cold or sinus, you have excess mucus being produced. So it's not just running down the back now, it's even coming out through your nostrils or through the nasal passages. Again, excess mucus production. But that's just more of a runny nose compared to this phlegm build up that can affect your chest.
So how do we differentiate between a wet cough and a dry cough?
Okay, so a dry cough is when you are just coughing as a result of some sort of irritation in the throat and there's absolutely no mucus being produced. Okay. A wet cough is usually when there's phlegm. So you have this excess mucus being produced, and when you cough, you're literally pouring out mucus, almost to the point that you need to spit it out or swallow it, depending on where you are. And so the moment there's excess mucus being produced or phlegm in the lungs, it triggers a reaction, a response to help us to get rid of that excess mucus. And that's when we start having a wet or productive cough, mucus-producing cough.
And what are the different causes of like wet and dry coughs, flus?
So just basically what you're saying is, remember, because all this can be a natural process, we must be careful just to rush to try and get something to stop a cough, because mucus production can be normal. Okay. Coughing is an essential process to get rid of it, so you don't want to take something to necessarily suppress it. So your dry coughs would usually be as a result of influenza, where there's not much mucus being produced, and sometimes even acid reflux. So if you have heartburn or a lot of acid being produced up your food pipe, it can cause an irritation in the back of the throat. Sometimes a slight post-nasal drip when you're sinusy can also cause a little bit of a scratch, and then that makes you cough. So that's normal. This is usually a dry cough. You don't want to take any cough mixtures for that. And the same way, even when it's mucus producing or phlegmy or wet cough, it's your body's way of getting rid of that excess mucus. If you're taking something to suppress the cough, you're causing the mucus to build up. And so when you have a wet cough as a result of a chest infection or asthma or inflammation, irritation from cigarette smoke, from air conditioning systems, you also don't want to rush to take something you rather want to eliminate the cause or treat the direct cause, and that's how you would then manage it.
So how do you know when you do need to take something for the cough, or like what symptoms sort of should trigger you to go to the doctor for medication?
Okay, so usually if the mucus can be excessive, if there's shortness of breath associated with it, if there's a high temperature, and generally if you feel sick. Also, a cough that just doesn't want to go away. So if you've had a cough for more than 2 weeks and coughing incessantly, that is a problem, right? If there's any time that there's blood in the mucus, okay? And if you can't sleep at night because the cough is irritating you all the time, those are some of the reasons. But if you are able to get through your day and you still can function, it's probably okay.
Winter is normally considered like cold or flu season. What sort of advice can you give to our viewers to stay safe from the flu, or if they actually have already caught one?
Yeah. So it's the two best remedies against the influenza, because influenza is the common one and the dangerous one. So influenza is what causes acute onset of severe headache, usually a dry cough, fever, body aches and pains. The best preventative modality for that is the flu vaccine and what we call hand hygiene. Meticulous taking care of your hands, washing your hands, having an alcohol-based sanitizer, because this is how we transmit the virus. You cough, keep it there, and you go and shake someone's hand, or you're touching the surfaces, you make coffee at the machine, and people get it. So you want to sneeze into your sleeve, keep your hands clean, and take the flu vaccine.
And with regards to the flu vaccine, for example, if someone has just perhaps caught a cold, they didn't get the vaccine on time, you've recovered now from the cold, is there a point in still getting a vaccine because winter's still a few months, to go?
So just to clarify, yes, it's never too late to get the vaccine. Obviously, if winter's over, it's a bit late.
Yeah.
But the vaccine just protects you against the influenza. It doesn't help against common colds. Okay. So even if you have a cold, it's still fine. And as long as you don't have an allergy to the vaccine and that you don't have an active flu infection at that time, it's okay to get the flu vaccine. So we want everyone to get, as many people as possible, to try and get the flu vaccine for this year.
And just lastly, the myth about eating more oranges during winter, is there any, is it necessary for extra vitamin C? So
yeah, so two things. Let me just come back to the issue of phlegm, because I said you mustn't take anything. Be careful. There are medications called, that contain a substance called N-acetylcysteine, and this is what you want to try and thin the mucus. And that helps to alleviate the cough, keeps it thin, prevents infection, and helps you to get rid of it easier. Vitamin C, which is in oranges, there has been no evidence that it does anything. So anyone who's pumping themselves with vitamin C to try and prevent colds and flus, anyone who's pumping themselves with vitamin C during a cold and flu, you're probably just taking in excess. You're just going to urinate it out. There's no evidence that it does anything, whether to treat or to prevent the common cold.
Well, thank you so much for that insight and for joining us here on Vogue Africa. That was Dr. Marlin McKay joining us in studio, just giving us a bit of insight on the benefits of actually having a bit of healthy mucus in the body.